Hello and welcome to this video. My name is Kris, I'm an Australian GP, and today I'm going to be walking you through yet another bite-sized video breaking down actually this time not so common condition known as GBS. Now, the pronunciation will vary. It is French and I am not, so I apologize if I'm not pronouncing it correctly. I've heard it pronounced as Guillain Barre, Guillain Barre, and so many iterations. But basically, I'm going to call it GBS just to keep it, I guess, correct as much as I can. It's obviously going to be written here in the description, everything. But today we're covering GBS. GBS is probably one of the very first conditions I've covered that is actually a rare condition, this time a neurological condition, so one involving the nerves and the brain. And it often follows a viral infection or an infectious disease of some description, where the immune system, for some reason, is switched on and actually starts attacking the peripheral nervous system. So not the brain, but the nerves sort of everywhere else. So not the brain or spine, the peripheral nervous system. The main hallmark or symptoms of GBS is this ascending paralysis, which can vary from quite mild to really life-threatening, especially if it ascends to the point where it starts to reduce a person's ability to respire or breathe on their own. So it can be absolutely terrifying. It also can affect anyone of any age after pretty much any infection. There are some that it's more, linked to, but it's just one of those scary things that happens. Sucks. So infectious disease can occur in any system, and the main systems where the disease occurs and then GBS follows tend to be respiratory infections or gastrointestinal infections. So not commonly, skin infections, for example. Initially, the symptoms may simply be just tingling, especially of the toes or the feet. Sometimes the hands as well, but usually it starts in the lower limb, at least in my experience. And patients often also complain of a pain in their legs, kind of in their feet and calves. Sometimes though it can also be in the back, so it doesn't follow the same pattern for everyone. Secondary symptoms, so symptoms that follow that, typically are difficulties with mobilizing or walking. Sometimes people say they just are very tired and can't make it upstairs or find that they're too weak to walk certain distances. These symptoms tend to be on both sides, so bilateral, not just the right foot or the left foot necessarily, but both sides ascending pretty much equally. So it's not like one leg is worse up to the hip than the other to the knee, but again, there's no textbook perfect patient out there, unfortunately. Diseases don't follow textbooks. And it can ascend until the point where it starts affecting the hands and the arms, and then, like I said, it can start affecting the core muscles, including those of the respiratory system. Additionally, and scarily, people can also have difficulty with blinking, chewing, swallowing, speaking, keeping their balance. People may also have a really high heart rate, have troubles digesting food, have poor bladder and bowel control, big variations in their blood pressure. They can also have an irregular or a high heart rate. So to diagnose GBS, a fantastic history needs to be taken. We need to know when things started, how they've progressed, and also the prior history. So was there an infection? What was it? Did we culture anything? Like, was it C. difficile? Was it Haemophilus influenza? What was it? Sadly though, a good history and examination isn't often enough for GBS because the symptoms vary from person to person and from instance to instance. And these symptoms are not always just GBS symptoms. So you can get weakness in the legs for a million reasons. You can get tingling in the hands for so many reasons. So the only definitive way to diagnose GBS is a lumbar puncture or a spinal tap. The result of this usually is to make the diagnosis, is a low white cell count but high protein count in the cerebral spinal fluid, or the CSF. So how do we treat GBS? Well, there is no cure for GBS. It's really just symptom support, as it tends to resolve itself in time with support. There are treatments out there that can help expedite this or protect you from worsening symptoms, including plasma therapies, IV immunoglobulin therapies, and physiotherapy to maintain the strength and integrity of your musculature. and depending on the severity, quite often a hospital stay is required, and this length can vary just depending on you and your symptoms. So it's terrifying, it's scary. It's not common at all. Like I said, it is a rare disease. So I don't want you to think that the next time that you get an infection, you're gonna get GBS, because no, it is very rare. I've seen maybe 4 patients in the last 7 years, maybe 3 or 4, not many if you count on one hand. So yeah, not common at all. And that is GBS in a nutshell. So I hope you found this informative. I hope it didn't scare you, because again, that's not my intention. Just wanted to explain what it is, how it presents, and how we treat it, and how we investigate it. So if you've got any questions, let me know. If you have any topics you'd like me to cover, let me know. But until next time, do stay safe, stay healthy, and I'll see you in a video very soon.